was it? Pandemic Day 9. Today is March 19th, 2020 at 8:51 p.m. And currently the total number of confirmed cases is 13,680. And total deaths have reached 200.
That's all in the U.S.
108 recoveries.
And yesterday,
wow. That's like,
it's like at least over 3,000 person jump, right?
dude, that's like almost double.
From yesterday, yeah.
Were we at 6,000 something yesterday?
No, we were at least at 7.
Okay. Yeah, almost double. Still.
And that's due to just the test kits getting out now.
Yeah, it's expected for sure.
And most of that's mainly in New York.
Yeah.
North Carolina has 123 confirmed. No deaths.
Yeah. I think California is another big one. It's mainly California, Washington, and New York. New York has the most.
Mainly New York. New York has a lot.
New York has the most, which makes sense. It's everyone's in cramped quarters there.
Yeah.
But
major headlines today.
Were there
I don't know.
I mean, Trump had a press conference today. Oh, I guess they've been testing malaria medication.
Yes.
And that's been promising. They also reiterated that the vaccine is going to take at least 12 months.
They also had a statistic, like 40% of people that had to go to the hospital were between the ages of 20 and 54. So they were saying that young people are perhaps more susceptible than we thought. To me, that's stupid because that's such a huge range.
Yeah, I think it's more so because young people aren't taking it seriously.
I agree. It's trying to get us to stop.
And I have to imagine that a majority of that 40% are like 50.
Yeah, I mean, that's what I would think too.
But that being said, still, the stat is what it is.
But we went to campus today, as did a lot of people, actually.
Yeah, we moved out, my girlfriend. And
it was fine. It wasn't crazy crowded, but there were definitely folks there.
There were definitely folks there.
And honestly, like when we got back, we switched clothes, we showered.
Yeah.
We were actively trying to sanitize ourselves.
Yeah, every time we left and came back, we used hand sanitizer.
Yeah.
It was weird.
It was weird.
It was weird because, I don't know, I go there a lot. But it was just strange that, like, another person's in the elevator and you're like...
Yeah, it was unsettling.
Are you one of them? Are you contagious?
I didn't want it. When someone else was in the elevator and the door opened, I didn't want to get in, just like out of courtesy.
Yeah.
But then when we were in it, people would just get in.
Yeah, well, that happened to us both times. Like, somebody didn't get in when we were in there.
Oh, yeah, that's
and
true.
And then somebody...
good man.
Good person. Yeah. Somebody got in.
There were kids playing volleyball, though.
I have to imagine...
People skating.
I have to imagine the people playing volleyball all knew each other.
Yes.
They're, like, stuck on campus. They didn't seem
true.
like... I wonder if, like, a random came up to that volleyball court. They would turn him down.
Yeah.
Because, like, that's what you do at that place. I mean, that's where you just play pickup.
It was weird, though, because, I mean, imagine being, like, a freshman right now. Like, your second semester just started, and now you have to go home. Like, you don't live in an apartment off campus or a house. You live in a dorm.
Yeah.
And you're gone. And honestly, I mean, that's not just freshmen. That's a lot of people.
Even, Aaron was telling me that even the people who lived in the apartments had to go home.
Like, Wolf Village and stuff?
Right, yeah. Wolf Ridge. Like... The on-campus apartments were forced to move out as well. It's
crazy. The provost sent out an email today saying, not with information, but just saying, like, look, this is a really hard time, but, you know, we're still the Wolfpack. We're here for you guys.
Yeah.
Which was, I thought was cool.
I will say, when I was walking through Tally, because I had to pick up some camera equipment, one of the big things at NC State is the ice cream. And so, like, families like to go there and, like, get a scoop whenever they come to campus. And they were limiting the amount of people in there.
Oh, really?
Yeah, the doors were shut, and there was somebody there. And, like, when people left, then the lady would let people inside.
Right.
So that was...
It's real.
Yeah. No, it's... just paranoid, really, from other people a little bit.
Yeah. I don't know. I mean, you need to isolate.
Yeah,
I think if we want this to go away, you got to isolate.
Yeah, well, not even if we want it to go away.
If we want to not overwhelm the healthcare system.
Yeah, if we want a spot on one of those hospital beds.
Yeah.
I guess.
I think that was mainly about it.
That was almost the entirety of what happened today. News didn't change much.
Yeah.
Besides that, I think in New York they limited work from 50%.
75% had to stay.
Yeah, 50% workers on the task force moved down to 25%. And so 75% had to stay home.
But no craziness, really.
Yeah, I think everyone's just kind of waiting to see the data because they are expecting sharp spikes.
I mean, tomorrow.
In the coming days, just because they have more tests out. But after that, the hope is that we flattened the curve.
Yeah.
That everyone's talking about. I don't know if we've talked about that on here, flattening the curve. But
yeah.
So that's the key phrase everyone's using.
I'm sure. I mean, you guys have seen it probably.
Yeah.
Yeah. In order to not overwhelm the healthcare system, you can't have a huge spike.
Yeah.
You have to have kind of a gradient that has an easy slope.
Yeah.
But yeah.
That's all we can do.
You know the drill.
Stay safe out there.
Stay safe out there.